Hi, I'm Dr. Dan Foss with Pura Vida Chiropractic. Today I'd like to talk to you about chiropractic and Lyme disease. I have patients I've seen in the past before that have suffered from Lyme, either at the initial stages of Lyme, initial infection, or from a secondary or tertiary infection where they've had many neurological effects from Lyme disease. There can be many different things, many different symptoms that Lyme disease patients suffer, but many of these symptoms all relate back to the nervous system because the Lyme disease is what's called a spirochete bacteria. And as a spirochete bacteria, it's a round bacteria, almost like a spiral, almost like a corkscrew, that's able to kind of dig in through the blood-brain barrier and really get deep into the nervous system. When that spirochete gets deep into the nervous system, it starts to create a lot of changes in the nervous system. And so one of those changes is having an effect on the neurological system and what are called the meninges, meninges are basically a membrane that surrounds the spinal cord. If that spirochete gets deep into those meninges, what it does is it can burrow into those areas and get deep enough where antibiotics or any other type of pain medication or even antibiotic can't really reach, and that can start to create different neurological problems. So first and foremost, very important that a medical doctor can really look at Lyme disease, and very important that you're managing Lyme disease really kind of multiple ways, but looking at it from an infection standpoint, from a pain management standpoint, but also looking chiropractically in that how can we get the body and how can we get the nervous system to function more properly. I've seen over 8 to 9 Lyme disease patients in my office, ranging from the initial stage, initial infection, to, like I said, tertiary phases where they're starting to have neurological problems, be it visual changes, severe headaches, ambulatory problems, be it difficulty, weakness in the arms, weakness in the legs. And really, depending on a case-by-case basis with my patients, we're able to get in there and make some changes into the spine, and they notice some really good changes from adjusting and lining up the spine. That's really helped to kind of take that tension, take that stress out of the body, and at the same time help them to function and live a better life.